Okay, so let's talk about skin appendages. And skin appendages include your glands, your hair, and nails. So we already talked about the glands pretty much in depth in the previous lecture. So let's talk about hair. We did already talk a little about the hair, but here we have, well, let's talk about more specific structures in your hair follicles and your hairs. So here is what a muscle we call the erector pili muscle. And remember, a characteristic of muscle tissue is that it contracts. So when it contracts, it moves. So when this erector pili muscle contracts, what does it do to the rest of the hair? So what it will do is it'll cause this. And if you're from the mainland, I've heard like goose bumps or goose pimples. But if you spend enough time here in Hawaii, you probably know the local term is called chicken skin. And this is why we call it chicken skin. These little bumps kind of look like a plucked chicken right here. But yeah, that's what causes your hairs to stand on it. It's due to the contraction of these muscles that causes the hairs to move, but also causes these raised pimples or goose pimples, goose bumps, chicken skin. That's what causes all of those. Now, this connective tissue sheath and this root hair plexus. So, this root hair plexus is actually a branch of nerves. And what we have with this connective tissue sheath, if you ever plucked a hair and looked at that glassy sort of like material that covers the base of that hair, that's the connective tissue sheath you pulled out. And why does it hurt to pluck out hairs? Well, it's due to this root hair plexus. If you pull out the sheath, you trigger these nerves right here. That causes that sensation of pain you feel when you're plucking out those hairs. Or if you, I never got waxed, but I mean, if you ever watched, there was this movie called The 40-Year-Old Virgin, and he got waxed. Oh man. Not only did he get waxed and start screaming in pain, he also got started bleeding. And again, look what we have here, blood vessels. If you have enough like mechanical, if you rip it out with enough stress, you can actually break some blood vessels as well. And then okay, so what is she looking at here? She's looking at split ends. So what causes split ends? Well, the thing is that, look at this. This is an electron microscope. So now we're looking at the very up close to the shaft of a hair. And what you can see is that kind of overlaps like little shingles right here. But the thing is that as your hair grows and it gets longer and longer, as it migrates further, well, when it gets older, the further it is from your scalp, the older that hair cuticle is. But also this starts to fray the further you get from that base of the hair. Now, why is that? Well, now we're back to our sebaceous glands. Remember, these are connected to the hair follicles, and it's important in keeping this. So, sebaceous glands are kind of like your own body's natural conditioner. But that's why people with very long hair, like my hair has never been long enough where I had to use conditioner. But again, if you wash your hair with very strong detergents and strip a lot of these oils and waxes, well, this is also what kind of keeps the surface and cuticles of your hairs very smooth. And this is the whole, like, why people use conditioner. By adding a lot of these oils and waxes, you kind of help to preserve the structure of your hair as it gets older and older and longer. Again, sebaceous glands, very important. They produce that sebum to help coat your hairs. Now, what do we have here is like the cross section. So here's the hair matrix, and this is where you have those actively dividing cells that are undergoing mitosis. And as they undergo mitosis, they start to push up layers and layers of these cells. And so it is a modified epithelium. And this is the stratum basale of that epithelium, it starts to push it up. And as just like the stratum corneum of your epidermis, the cells get flatter. Same with the cells that end up being pushed up along your hair shaft. So as they get further and further from the hair matrix, they start to flatten out and accumulate that protein we call keratin. So again, this is why your hair is made out of the same thing, protein, all in that keratin category, and that kind of water resistant hydrophobic protein. Now the thing is that, so have you ever if you plucked out hair, you know that, okay, most of the time it grows back, but sometimes you pluck out a hair enough, like now thick eyebrows are in, but I think maybe when the early 2000s, very thin eyebrows were in. But a lot of women, including don't tell my mom I said this, but my mom would also pluck her eyebrows very thin. but a lot of her eyebrow hairs don't grow back. So the thing is that if you also damage this hair papilla, that's one thing that can cause a hair to not grow back. These are actually blood vessels. So if you damage the blood vessels and damage the strand basal of the hair matrix when you pluck out a hair repeatedly, if you take out the germ cells and there's no damage and if you damage the blood vessels enough that can't supply the nutrient and oxygens to grow more cells, that can prevent the hair from growing back altogether. So now let's talk about nails. And what we have here, well, we all have nails and we know how it grows. And as you can see, this is why if you look at your nails up close and look along it, so you can kind of see these vertical lines that run from the nail root right here and move toward the free edge. So again, it's not just like completely smooth. You can actually see the little ridges. And why is that? Well, this is, again, it follows the direction of growth. Now, what we have here is the nail root. So this is where you find all those cells that are actively undergoing mitosis and dividing. So as they divide, they start pushing the cells that form your nail this way. And as they get pushed further and further, they start flattening out and they start to accumulate keratin. So it's kind of like a stratified squamous epithelium. But instead of building from the deep towards the superficial, is pushing it this way along the direction of growth of your nail. Now this eponychium, this is where you have like that little fold of skin that covers the base, the root of your nail. And this hyponychium is that part right below, that fleshy part right below that edge of your nail. So we know about, we all have nails, and we've always seen this like amazing nail art and whatnot, but our nails just superficial and just something we have to trim every so often to keep it manageable. Well, the thing is that nails, just like your skin, can be an indicator of health. All right, let's look at these nails right here. And oh boy, yeah, these look unhealthy, but thing is that these are I just Googled fungal infections of nails. So things that remember that your nails, they're made out of keratin. They're made out of cells that accumulate keratin. Thing is that some species of funguses or some species of fungi like that keratin and like all they love growing on the nails and eating all the nutrients and proteins that your nails have. So if they're kind of making themselves at home and digesting your nails, well, this can result in these brittle, cracked, and split nails. So if you have like a severe case of athlete's foot, you might need, or if you have these nails, you might need an antifungal agent to help cure this and clear the fungus, so it's no longer eating your nails as they're growing. Yeah. Now let's look at these nails right here. So notice that instead of being rounded at the top, they're kind of indented. They're kind of pushing into the nail body and into the finger. And this is a term we call koilonychia. This is due to an iron deficiency. So if you have a lack of iron in your diet and iron deficiency anemia, this is a classic symptom of that. That causes the nails to grow funny, and instead of having that nice rounded shape, now they're indenting in toward the body of the finger. Now, what do we have here? Notice that there's a black stripe, but pay attention to the direction. So notice that these are running parallel to the direction of growth. So remember that the nails start right here at the root and they start all the cells toward this way. So something is over here causing a dark color and it's being pushed along this way. So when you see this black stripe, it could be actually something called subungual melanoma. So the thing is that it's not a melanoma that you can see like a regular mole, but this melanoma is hanging out somewhere near the nail root, but secreting melanins. That's the funny thing about cancers. They grow uncontrollably. They often retain some sort of characteristics of the original cells that they developed from. So this is a cancer that's still producing melanin. But the thing is that as it's producing melanin, as the nail root grows and these cells get pushed up, the melanin goes along for the ride. So if you see a black stripe that goes along the direction of growth, you might want to get that checked out because again, if it's melanoma, you want to catch it early before it starts to spread. All right, so what we see here is something called Bowes lines. And notice that compared to those black stripes that were running parallel to the direction of growth, Notice that these are perpendicular, they're horizontal. Now, what could cause Bowes lines? Actually, many things can cause Bowes lines, like even things like nutritional deficiencies. Again, if you don't have enough nutrition, maybe you're not getting enough protein to produce keratin. Or even things like vascular disease. Like I think one student said that his mom experienced a heart attack and she started developing those Bowes lines. So it could be vascular injury, it could be even infections that cause that, or things like chemotherapy. Remember, chemotherapy, it tries to kill the cancer cells, but also kills actively dividing cells. Where do we find actively dividing cells? Well, hair follicles. That's why people undergoing general chemotherapy, their hair falls out. But you also have those actively dividing cells at your nail root. So if those cells get hit with chemotherapy, maybe they'll start dividing as much for a bit. That could cause a difference in the texture and development of the nails during that time. So Bowes lines, it means it's not always a reason for concern. It's like maybe you encountered something in the past, but that past is behind you, so you don't have to worry too much about that.